of approval for my eye checkup. I think that came in yesterday. Let me check the app. There it is. I can go see my doctor now. I swear, if I didn't have a healthcare plan, I wouldn't think to look out for myself.
It's been really hectic lately at the store, and we almost didn't have time for my employees' annual checkup. Good thing MediCard does on-site testing. We can continue with business as usual, and my employees don't have to do more work to get their health checked. Thank God for MediCard.
I used to be able to do it all, but I'm too old to spend my time on long queues. That's aging for you, I suppose. Being able to do these tests at home brings me so much comfort.
Come a long way in building a healthcare system that lives up to what we aim to be, to serve as the lifeline of our clients, a bridge to health. 35 years, fueled by a desire to make healthcare affordable and accessible to everyone, inspired by the trust of our clients. We want our members to feel like they can enjoy their lives to the fullest, that they can give their best shot in pursuing their aspirations because they are in their best of health, and that they can take comfort in knowing that the healthcare they need is just within their reach. Thank you for entrusting your health to us. It's what we're here for.
Okay, so good morning to our guests and viewers. So how are you feeling today? Hope everyone is having a good morning. But first of all, happy 35th anniversary to MediCard, and I would like to thank you all for being with us today as we celebrate our company's anniversary with the webinar series. So yesterday, we had our first online talk show, the MediCard Talks, which we talk about overall health and well-being with our expert, and of course, the newest innovation of MediCard and the vision where MediCard is heading to. But before I introduce our speaker, let's take a quick poll and look at your screen and click on where do you think you belong. So may I ask our tech to flash our first poll? Okay, so while waiting for our quick poll, okay, so we have this series of questions. So first question, kindly pick what is applicable to you if you have a high BMI, a family history of diabetes, maintenance medicine for diabetes, and high blood sugar result in my APE. So we are encouraging our participants to answer our quick poll before we start our session. Okay, so answers are coming in already. Okay, so we have also, I know someone with diabetes. Just simply answer yes or no if you know someone with diabetes or personally you have diabetes. And then also we have uncontrolled diabetes or poor control of blood sugar entails a lot of complication. Is it true or false? And also lastly, we have diabetes is one cause of blindness. So is it true or not? Okay. Okay, so far for our first question, we have 36% of our participants have high BMI, and then 73% has a family history of diabetes, and then also 13% from our audience has maintenance already for diabetes. And then lastly, 12% of our audience has high blood sugar result during on their APE. Okay, for the second one, so okay, if you've known someone with diabetes, okay, so 82% of our audience knew someone with diabetes. And then for the third, yeah, uncontrolled diabetes or poor control of blood sugar entails a lot of complications. So 94% of our audience believes that it is true. And then for our last question, diabetes is one cause of blindness. So 100%. So basically all of our participants think that diabetes is one cause of blindness. Okay. Okay, so we need, before I introduce our first speaker, okay, so our topic today is a diabetic eye disease, which we will get to know more about with the help of our expert. So our speaker today graduated Bachelor of Science in Biology and Doctor of Medicine at University of Santo Tomas and acquired his ophthalmology residency at Carlos L. Sevilla Eye Center, Makati Medical Center, where he served as a chief resident. He got medical retina fellowship at Singapore National Eye Center. He was previously a guest faculty at Ateneo School of Medicine and Public Health and also had an experience working as a company physician. So without further ado, let us all welcome Dr. Joel Perez.
Hi, good morning, everyone.
Good
Um,
morning, Doc.
should I start my share my slides now?
Yes, Doc, you may share your screen already.
Okay. All right. So our topic for today is about diabetes. So as we saw in our poll this morning, a lot of us um, have diabetes or at least know someone who has diabetes. No? So let's learn how diabetes affects our eyes and our vision, and um, let's continue to fight diabetic blindness by spreading awareness as well. Okay. So, what is diabetes? No? So, ano ang diabetes? Diabetes is a disease that affects the body's ability to produce or use insulin effectively, no, to control our sugar levels. So, when someone has diabetes, usually we say na taas ang blood sugar, right? And these are some of the tests that indicate that you have diabetes. HbA1c or hemoglobin A1c of greater than or equal to 6.5, fasting blood sugar of more than 126, and oral glucose tolerance test of more than 200. So, what are the symptoms of diabetes? So, the diagram on the right shows the different symptoms of diabetes and how it affects all systems of our body. You know, the most common ones are yung madalas na pag-ihi, palaging uhaw, palaging gutom kahit kumain na, matinding pagod, sugat na hindi gumagaling, namamayat, at pamamanhid ng mga daliri. So too much glucose in the blood for a long time can cause damage in many parts of the body. So diabetes can damage the heart, the kidneys, and the blood vessels, and it damages small blood vessels in the eye as well. So here we have a photo of a normal retina and the diabetic retina. No? So ano ba ang tinatawag na diabetic retinopathy? No? So the retina is the back part of the eye. No? And if you can see here, on the right-hand side, we compare it to the normal retina. Um, we see a lot of areas of bleeding and leakage, and this causes the blurring of vision, no, na tinatawag na kasali sa diabetic retinopathy. So ang retina ay parte ng mata na kumbaga kung i-compare natin ang eyes natin sa isang camera, the retina is the film, no? So it's very essential for our vision. So diabetic retinopathy is a complication of diabetes, and this is the leading cause of vision impairment and blindness among working age adults. So when we say working age adults, age 20 to 60, no? So um, it occurs when diabetes damages the tiny blood vessels in the retina, which is the light sensitive tissue at the back of the eye. No? So when we say this causes blurring of vision and blindness in working age adults, this definitely impacts person's quality of life, ability to work, and enjoy their daily activities. So, how does diabetes damage your eyes? The tiny blood vessels in the retina are damaged by high blood sugar, high blood pressure, and high cholesterol. No? So a healthy retina is needed for good vision. These blood vessels can also swell up and they may become blocked. And complication of this is new weaker blood vessels may form. So if you look at the picture here, these are all abnormal blood vessels that are weak and they cause further bleeding and can even lead to retinal tears and detachments. No? So people with diabetes are also at risk for other diabetic eye diseases such as cataract and glaucoma. So this is another diagram comparing a healthy eye from a diabetic eye. And if we look here, a diabetic eye, we see abnormal blood vessels that are growing, and these blood vessels cause bleeding inside the eye. Aneurysms may also form, and cotton wool spots can be seen as well on the retina on examination. So who can develop diabetic retinopathy? So all people with diabetes, including type 1 and type 2, can develop diabetic retinopathy. So this is the most common diabetic eye disease. And it's important to note that in the short term, your eyes may not be affected, but the longer you have diabetes, the more likely it is that you will develop diabetic retinopathy. So, uh, posibleng magkaroon, halimbawa kung kayo'y may diabetes, number one. Number two, uncontrolled blood sugar, no, or hindi kontrolado ang blood sugar. Maraming taon na may diabetes, so long years na yan usually. Uncontrolled blood pressure can speed up diabetic retinopathy. Having high blood cholesterol can also speed up diabetic retinopathy. Kidney problems then can aggravate diabetic retinopathy. So even those who were diagnosed with gestational diabetes must be also checked. So more than half of people with type 1 diabetes have some type or have some kind of retinopathy after 10 years. No? And in people with type 2 diabetes, almost one third of people diagnosed already have retinopathy at the time that they are diagnosed. So how can, how can diabetic retinopathy cause vision loss? So it can damage your eyes even before you see changes in your vision. So if you look at the picture on the left-hand side, this is an example of how a person with diabetes can see. On the left-hand side, it's still normal actually in the first few years, but if you leave it untreated, it can definitely cause vision loss. We compare the left-hand side on the right-hand picture, we see definitely some patches in our central vision. So how is it detected? There are no warning signs for diabetic retinopathy, and a dilated eye exam allows your ophthalmologist to see the early signs of the disease and can help you before your vision is affected. So the goal here is to diagnose and to treat diabetic retinopathy early so you can help protect your vision, no, and avoid it from progressing to cause loss of vision, right? So your ophthalmologist will look for changes in the blood vessels. They will look for leaky blood vessels and changes in the lens and damage to the nerve tissue. So what happens when you get a dilated eye exam? So when we say dilated eye exam, it is actually the pupil that we dilate. We have an example here on the left. The central part of your eye, or the black part of your eye, that's your pupil. And dilating drops or medicine will be put in your eyes to dilate or to widen the pupil, as we can see here. And your doctor will use a special magnifying lens to look at your retina and other parts of the eye. So when we dilate the eye and we examine you, at the slit lamp, we are able to see the back part of the eye and able to diagnose diabetic retinopathy. These are other additional exams that your doctor can also request for, such as optical coherence tomography. As we can see here, this is an eye with diabetes, and we see that the retina is swollen and there are areas of patches of swelling. No? And there's also another test. It's a fluorescein angiography in which we are able to see the blood vessels of the retina. So ano ba ang ginagawa pag may diabetic retinopathy ang mata? No? So treatment for diabetic retinopathy will depend on the stage of the disease. So we need to find out if you have mild, moderate, severe, or advanced diabetic retinopathy. If we look at the photo here on the right-hand side, we see areas of hemorrhage, no, obscuring the retina already, and there's this patch of abnormal blood vessels that is causing further damage to your retina. So if you have mild or moderate diabetic retinopathy, usually sinusubaybayan lang ang mata, or we just observe the patient every 4 to 6 months. Here we have another treatment for now for severe or advanced. So if you have severe or advanced stage of diabetic retinopathy, we can do laser, or what we call panretinal photocoagulation, wherein we treat the retina with laser. No? So on the photo on the right shows a treated retina with diabetic retinopathy. So these black patches over here on the periphery are actually laser scars, which can help prevent diabetic retinopathy from progressing. Another treatment is intravitreal injections. So especially if there's swelling of the retina that causes blurry vision, we can inject medicine inside the eye towards the back part of the eye. No? So this is what we call anti-VEGF injection. This can help treat the swelling of the retina. And if you have advanced diabetic retinopathy, like for example here on the photo on the right, we can see that blood has already filled up the back part of the eye, and this has obscured the vision of the patient. At this stage, or what we call the advanced stage, surgery is already needed to evacuate the blood or the hemorrhage at the back part of the eye. So paano ba maiiwasan na magkaroon ng diabetic retinopathy, or how can we slow down the progression of diabetic retinopathy? So these are steps that you can do to reduce the risk, no, of your retinopathy getting worse. So you need to attend to your diabetic eye screening appointments every year. Your blood sugar or HbA1c should be kept at levels agreed with your doctors. So usually this is about nasa 7 and below. You also need to see your doctor regularly to check that your blood pressure is not raised. You should also keep your cholesterols in check, no? Make sure that you're taking your maintenance medications as well for cholesterol. Of course, eat a healthy and balanced diet. Try to lose excess weight if you are overweight, and always take your medications as prescribed by your doctors. Try to exercise regularly, and if you do smoke, please try to cut down or stop smoking if you can. So, tandaan, no, diabetes ay panghabang buhay na sakit na kailangan ng panghabang buhay na gamutan. Ito ay nakakabulag kung pababayaan. May mga paraan upang maiwasan ang paglala ng sakit sa mata tulad ng diabetes, no? It's very important that you consult with an ophthalmologist. So our take-home message for today, kahit wala hong nararamdaman sa mata, kahit malinaw ang tingin, kailangan magpa-check sa eye doctor. Hindi sapat ang magpalit lang ng salamin. So, thank you. That's the end of my presentation. I hope everyone learned something today.
Okay,
Yeah,
yeah. Okay, so thank you so much, Doc Joel. So we are now opening the floor for the Q&A. So to facilitate our Q&A, may I call on Dr. Pauline Faustino, Assistant Manager of MediCard On-Site Clinic Management and Health Promotion.
Hi, good morning. Good morning, everyone. Good morning, Dr. Perez. So thank you
morning.
very much for that very simple yet very six information and what we should understand about diabetes and the complication of diabetes. I think that we have a question here. You mentioned in the last portion of your talk that it's not enough to just change your glasses, no? So how would you know, Doc, that, for example, is that a sign already that frequent changing of the eyeglasses will entail possible risk na already of a retinopathy?
Well, given if you have a diabetes already and then you notice that you frequently change your glasses, it could be a sign that your blood sugar is not controlled because fluctuation of blood sugar can actually cause swelling of the lenses of the eye. So it's a sign that if you change your glasses often, then your blood sugar is not controlled. No, so definitely we need to check the blood sugar levels of the patient and have the dilated eye exam as well.
I think you also mentioned, Doc, in your presentation that type 1 or type 2 diabetes can both have a risk of developing the retinopathy. Can you mention again, Doc, the difference between the type 1 and the type 2 diabetes patient?
Type 1 is usually in younger patients, no? So these are what we call yung insulin-dependent diabetes, and yung type 2 is usually seen in adults. So usually, ito yung mga mas common actually.
Mm-hmm. Okay, and then Doc, you mentioned also that about 1/3 of the people diagnosed with diabetes already have some sort of retinopathy. No, and
Correct.
then of course, learning about the risk factors that should already at least prompt a patient to at least seek initial consult in terms of the health of their eye in relation to their condition. Ayan. So Doc, I'm reading now some questions from our chat box. Is having frequent migraine already a risk of having diabetic eye disease if the pain is felt mostly in the part of the eye?
Migraine is actually not related to diabetic eye disease. Usually, people who have migraine also experience some form of symptoms involving the eye. But migraine is a completely different entity and should be worked up by at least an internist or a neurologist as well. No? If you have symptoms or pain, mostly on the eye part, it's better to be checked also by an ophthalmologist just to make sure that there are no other eye diseases that is causing the pain. But migraine usually is separate from diabetes talaga. It's not related po.
Okay. Okay, I think this is a follow-up question. Okay, I guess. if they are wearing clear the glasses now, but when looking at far objects, I look at my phone closely, it's blurred po. So I think
Mm-mm.
that's also one condition for needing to be assessed by a doctor.
Correct. Yes. Usually, when diabetes affects the eye, it affects both far and near at the same time. No? So it doesn't have a preference na yung far yung mas malabo or yung near yung mas malabo. But what you're describing is something else, no? It's what we call could be presbyopia, no? Wherein it's just the near vision that's affected. So better to have your eyes checked as well so that we can rule out any serious conditions. But usually, if it's just simple presbyopia, we can give reading glasses are okay naman.
Okay. We have a question about cataract, doc, but maybe a more relevant in relating it to our topic. Can
Mhm.
diabetes also cause cataracts?
Yes, definitely. Cataract is mainly caused by secondary to aging, no? But having diabetes can speed up the formation of a cataract. So, if you have diabetes, it can actually cause you to have cataracts at an earlier age and can cause a blurring, of course. Diabetes can also uh, increase your risk of having glaucoma, no? Which is another eye disease that can cause blindness.
Okay. And probably in relation to that, doc, maybe you can mention if
Mhm.
whether related to diabetes or not, if the cataract relating to cataract treatment, will it be good to have extraction or a laser daw po doc as a treatment
Okay.
of choice?
All right. So for cataracts, usually in general, all cataracts would need to have cataract extraction and placement of new lens. No, so um, laser kasi I've um, talked with a lot of my patients already. I think laser is a very loose term that we all use. No, parang kasi parang lahat na lang laser, but actually for cataracts it's actually a surgical procedure, no? Maybe yung laser it is parang just to separate, no? Yung laser kasi some of us use the word laser to describe the procedure, which is actually yung extraction and placement of new lens, no? So yun, I hope that answered your question.
Yes, I think so. Now, there's a question. Is it true that diabetes can be hereditary?
Yes, there's a definitely genetic component for diabetes. So if you have a strong family history of diabetes, better to have your blood sugar checked just to be sure.
Okay. Another question, doc. Are floaters related to diabetes?
Not necessarily. Floaters are commonly seen in more elderly patients, but these are most often benign. Um, Floaters are not exactly directly related to diabetes, no, but both diabetic patients and non-diabetic patients can have floaters. So again, to diagnose floaters and to make sure that uh, floaters is not caused by other more serious diseases, you need to also have your dilated eye exam, no, that I discussed earlier in the presentation.
Okay, thank you, doc. Doc, another question. When should we not ignore blurring of vision? So maybe in general, how would you advise
Okay.
our participants on this?
Okay. In general, it depends on how blurry is the vision. Does it affect your daily activities? And is it permanent or is it just temporary that only lasts for a few seconds? So a lot of factors would need to be considered, but definitely if you have um, blurring of vision that is permanent, you definitely need to have your eyes checked. Um, and then basically, we need to assess really what's causing the blurring, no? So that we can address the cause and offer solutions, of course, the problem. No? So I think having blurry vision um, that lasts more than a few seconds, definitely need to have your eyes checked po.
Yes, okay. Thank you, Doc. So another question on general eye health. Is it advisable, Doc, to use eye drops? The common
Like
eye drops that we have, like IMO, yes, Doc.
like IMO. IMO, usually a lot of people use eye drops for symptoms of dryness. That's the most common uh, cause. No, so symptoms of dryness include temporary blurring of vision, eye discomfort, gritty sensation in the eyes, and tearing or parang nag-watery yung eyes, no, kahit hindi naman naiiyak. And I think there are better drops than IMO to address these patients with dry eyes. I'm not entirely sure about the components of IMO kasi, but we would usually give what we call eye lubricants or artificial tears, and these types of drops actually mimic the composition of our tears. No? So these are more effective in treating dry eye disease.
Okay. Doc, in relation also to eye drops, there's also Quaylin is typing in our questions from Facebook. So, what about magnesium eye drops or a mint eye drop that is available in Japan? Is that safe to use, Doc?
I think I've encountered this mint eye drop. I think this is actually a lubricant, but of course, uh, you have to have it checked, not just to be sure. If you can, if you are going to your eye doctor and you can bring a sample of this, then mas confirm natin. But I'm not sure if we're talking about the same product, but some uh, artificial tears, they include some some cooling effect. So it's not actually mint, but parang a cooling effect for release, no, for the eyes. But I don't think that's available here naman in the Philippines. So yeah.
And probably in that area, their Food and Drug Authority would allow only if it's safe to use.
I hope so. Yeah.
Yes.
I think their Food and Drug Authority is more strict than ours. No? So in our situation, kasi some of the eye drops, especially if you buy it online or from Facebook, ganyan, we're not entirely sure kasi of the components of these drugs. So just to be sure, use drops that are prescribed by your doctors.
Okay, Doc. Thank you, Doc. So, Doc, we have a question. I think you're best to answer this. So, his father was diagnosed with borderline diabetes and has been using eyeglasses since his 30s. Do we have to visit an OPTHA, and how often will it be?
So borderline diabetes, I don't think there's any rush to have his eyes checked, but once he is on maintenance medications, the recommendation is to have uh, an eye checkup or a dilated eye exam, so that we can see if there's some form of damage already. No? Usually, kasi what we encounter in the clinics are we have patients who come in that are newly diagnosed that they have what's this? They just started on medication, but since diabetes doesn't actually have a lot of symptoms early on, the reality is they've already have had diabetes for years already na newly diagnosed lang. So for these cases, having the eye examination or the dilated eye exam, we can actually see some form of damage already. And this actually gives some information on how long the patient has had elevated blood sugars. No? So once you're diagnosed, it's advisable to have your eyes checked And yun nga, the follow-up would depend on the staging of the eye disease. So if it's only mild, probably once a year, eye checkup is okay. But if it's moderate or severe, um, I would have to see the patient in like from as frequent as monthly to maybe about 3 to 4 months. So it would depend definitely on the stage of the disease.
Okay. That's one thing to emphasize nga po, Doc, no, that you mentioned when you're diagnosed with diabetes, it doesn't mean that it's the first day or the first year that you have it. So it's
Mhm.
probably long before that time that you were diagnosed. So it's important to have that to be diagnosed, to be checked by an ophthalmologist. So
Yes, po.
okay. So, Doc, we have one question. Can lack of sleep cause blurring of vision?
It can affect your vision, yes. Especially when I don't know. Uh, when we test vision of patients who have slept for only 1 or 2 hours, so definitely fatigue can cause some blurry vision. However, this is temporary, and once you have recovered from your lack of sleep, usually your vision goes back to normal din naman. So yes, it can affect your vision.
Okay. Okay, Doc. And then one question. Static-like effect appearing in the visual field. He already did, she already did the retinal exam last November and turns out normal. Um, it seems that she checked about visual snow, but can you uh, have any comments on this kind of symptom? Static-like
Vi-
effect appearing in the visual field.
Okay,
Is
so
there
usually,
anything that you know about visual snow?
um, I'm not sure about visual snow, but flashes of light in the visual field are usually caused by stresses on the retina, or sometimes when the retina is tugged, if there's tension in the retina. So when a patient complains of seeing flashes of light, again, you need to have your retina checked to make sure that there is no tear in the retina or no detachment. Um, you may experience flashes of light also yung pag tinatawag nating meron kasing condition na yung posterior vitreous detachment. No? So that's actually a normal thing that's caused by aging as well, and it can cause flashes of light. So if you see flashes of light, it doesn't mean that your retina is already damaged, but we need to check it to make sure na there's no actual damage to the retina. Um, so yes, yung flashes of light is one symptom that you have to watch out for, and uh, you need to have your retina checked. Pagka ganon. Once you have your retina checked and your retina doctor says na it's clear, your retina is normal, then it's fine.
Okay. So I'm not seeing any more questions. So last call for questions. Meron pa ba? So maybe Doc, you can have, I know you already mentioned your parting take-home message for our participants, but maybe you can again mention that before we close our session.
Okay, so if there's one thing that you need to remember before our session ends is you need to keep your blood sugar in check, no? And how you can do this is to um, see your uh, doctor for diabetes or endocrinologist regularly. Um, take your medications as prescribed. Have your eyes checked by an ophthalmologist, including a dilated eye exam. And basically, if you checked and your uh, uh, endocrinologist have you check up on you, um, uh, blindness secondary to diabetes can be prevented. So uh, yes, so yun lang po.
Okay, thank you very much, Doc. So I will now call on Quilleen again for some announcement. Again, thank Dr. Perez for giving us this very insightful discussion, and we also thank our participants for actively participating, especially in our Q&A. Quilleen?
Okay, so before we end this talk, I would like to express our gratitude to Dr. Joel Perez for gracing our event today. I know all of us learned a lot from today's talk, and by the way, we do have an eye clinic already at MediCard Lifestyle Center. It is located in Paseo de Rojas Corner, Hilpuyat, Makati City. So you may schedule your appointment with our eye clinic. Okay, so ladies and gentlemen, this marks the end of our session. Thank you very much for joining us today. Keep safe, stay healthy, and hope to see you all again tomorrow until Friday, because we have a series of webinars prepared for you as part of our 35th anniversary celebration. So hope to see you all tomorrow and the coming days. Thank you so much for your time.
By with a multitude of changes, and every day can pass.
All new places, different faces in a world where changes everywhere you turn.
Find a friend you can rely on.
Hold the helping hand that shares. Keep the company that will truly care.
MediCard.
The company that doctors build.
MediCard.
The caring and the expertise. We're here
To serve you through the years,
for all that life may bring. We're here
to help
your family live in health and grow your dreams.
MediCard.
Doctors build
MediCard.
the caring and the expertise.
Finding
MediCard, MediCard, find the healthcare that you need
in MediCard. Time passes by with a multitude of changes, and every day can pass.
all new places, different faces in a world where changes everywhere you turn.
Find a friend you can rely on.
Hold the helping hand that shares. Keep the company that will truly care.
MediCard.
The company that doctors build.
MediCard.
The caring and the expertise. We're here
To serve you through the years,
for all that life may bring. We're here
to help
your family live in health and grow your dreams.
MediCard.
Doctors build
MediCard.
the caring and the expertise.
Finding
MediCard, MediCard, find the healthcare that you need
in MediCard. MediCard.